All right, let's do a deep dive into liver transplants today. We've got this document, the abdominal7.pdf. Looks like it's some med school stuff about examining patients after they get a liver transplant. Ready to play medical detective.
Yeah, it's amazing how much you can tell just from like looking at someone.
Yeah, so this document mentions a J-shaped scar that goes up towards the chest.
Yeah.
What does a scar like that tell us?
Oh, that J-shaped scar. It's called a Makuchi incision. And yeah, that's a sure sign of a liver transplant. It's kind of like a fingerprint that says, hey, a good surgery happened here. And it makes you ask a whole bunch of questions about the patient, their health, their past, all that.
So it's not just about the scar itself, it's about what it means, right? Like, what kind of questions pop into your head when you see a patient with a scar like that?
Well, first thing I want to know is, how's the transplant doing? Is it working okay? You got to look for signs that the liver might still be in trouble. Things like jaundice, maybe, or complications like portal hypertension and ascites. That's where fluid builds up in the belly.
Okay, so how do you actually figure out if the transplant is working right? Are there like specific tests or things you look for during the exam?
Yeah, so besides those physical signs, we'd also run blood tests to see how the liver's functioning. For example, bilirubin levels tell us how well the liver is clearing out waste from the blood.
The document also mentions immunosuppressants. What's the deal with those after a transplant?
Oh, immunosuppressants, those are crucial. They stop the body from rejecting the new liver, which is huge. But the thing is, they can have some nasty side effects, so we got to keep a close eye on those. Things like skin problems, higher risk of diabetes, even tremors sometimes.
So the balancing act then, right? Preventing rejection, but also managing these side effects.
Exactly. You got to find that sweet spot. That's why people who've had transplants need to be monitored their whole lives. We got to make sure the new liver is happy, the body isn't trying to kick it out, and that they're handling the meds okay.
All right, let's switch gears a bit. Why would someone need a liver transplant in the first place? This document talks about hemochromatosis, but what are some other common reasons?
Oh, there are tons of things that can mess up your liver bad enough to need a transplant. Cirrhosis is a big one, that scarring of the liver. It can be from all sorts of things. Drinking too much, fatty liver disease, hepatitis, even autoimmune diseases.
Right, cirrhosis, that's like the classic liver damage thing. What makes it so bad for the liver?
Basically, it screws up how the liver is supposed to be structured and how it works. You get all this scar tissue building up, and it blocks the blood flow through the liver, so it can't do its job of filtering out toxins and making important proteins.
It's like the liver's getting choked by scar tissue. So what
Yeah.
happens when the liver just can't function anymore?
Oh man, that's when things get really bad. Toxins build up in your blood, you might get fluid in your belly, your body can't clot blood properly, you're more likely to get infections. That's when you really need a transplant to swap out that damaged liver.
You mentioned acute liver failure too. How is that different from cirrhosis?
Acute liver failure is like, bam, your liver goes from okay to really bad super fast, like in a matter of days or weeks. It can be from viral infections, drug overdoses, even some herbal supplements. It's seriously life-threatening. You need help right away.
So there are a lot of ways you can end up needing a transplant, each with its own story.
Yeah, for sure. And each case needs to be looked at carefully to figure out the best way to help.
So how do doctors decide who gets a transplant? When there are only so many livers to go around, how do they choose?
That's a tough one. It's not just about who's the sickest. There's a whole system. It's called the UKELD score, which stands for UK End-Stage Liver Disease Model. They use that to figure out how urgently someone needs a transplant.
So the UKELD score is like a ranking system then.
Pretty much, yeah. It looks at things like bilirubin levels, which we talked about, also creatinine levels and INR. That measures how well your blood clots. The higher the score, the sooner they need a new liver.
Sounds like a pretty complex system to make sure things are fair.
It is. It's all about trying to make the most of the organs that are available and giving people the best chance of surviving.
Okay, so we've got this system for figuring out who needs a transplant. But what about after the surgery? What's life like with a new liver?
It's a big adjustment, that's for sure. We talked about the immunosuppressants. Those are super important to prevent rejection, but that's just the tip of the iceberg. You got to be so careful about infections because your immune system is basically taking a nap. Regular checkups, blood tests, biopsies to keep an eye on the liver.
Sounds like a lot to handle, both physically and mentally.
It is. You need a good support system, not just doctors, but family and friends too.
Speaking of which, there's that case study in the document, the patient with jaundice. Anything stand out to you about that case?
You know what's interesting about that one? The jaundice wasn't actually from the transplant itself. They were having hemolysis. That's when your red blood cells break down. It just goes to show that even with a successful transplant, other things can still pop up.
So it's a new beginning, but not a guarantee that everything's fixed, right?
That's a good way to put it. A new beginning.
Well, we've covered a lot already. That J-shaped scar, figuring out who gets a transplant, all the stuff that comes after.
And we're just getting started.
Exactly. In the next part, we'll dig deeper into what it's like to live with a transplanted liver. And we'll talk about some of the ethical stuff, too. Stay tuned. We were just talking about how you're always kind of looking over your shoulder for infections after a transplant. What about other challenges, maybe things that aren't so obvious?
Yeah, that constant worry about infection, that's a big one for sure. But there's also a whole lot of emotional and psychological stuff to deal with.
Like what? What kinds of emotional challenges come with a transplant?
Well, imagine this. You've gone through this major surgery, you get the second chance at life, but then you have to live with this fear that your body might reject the new liver. That's a lot to carry around.
Yeah, it must be really stressful knowing that this organ that's keeping you alive could be rejected.
Absolutely. And then there's the whole immunosuppressant thing. You have to take those drugs for the rest of your life, deal with the side effects, change your whole lifestyle.
Right, we talked about the side effects before. But what kind of lifestyle changes do people have to make because of the immunosuppressants?
Well, they have to be super careful about what they eat and how clean everything is to avoid infections. They might not be able to do certain activities or go to certain places just to stay safe.
It's like you're living in a bubble almost.
Kinda, yeah. It's like your immune system is taking a permanent vacation, and you got to be extra cautious. A lot of people feel really vulnerable, and it's a big adjustment.
The document mentions the financial side of things too, how expensive it all is.
Oh, yeah. Transplants are not cheap, that's for sure. The surgery itself, the meds you need for life, all the checkups and tests. Plus, if you have complications, that's even more bills.
So it's not just a one-time cost, it's an ongoing thing.
Exactly. And that financial burden can be really tough for patients and their families. Having a good support system and knowing what resources are available can make a big difference.
Let's go back to that case study for a second. It said the patient had gynecomastia, which is when men have enlarged breast tissue. What causes that, and how is it connected to liver problems?
So gynecomastia can happen for a few different reasons, but with liver disease, it's usually because of hormones getting out of whack. When your liver is messed up, it can't break down hormones like estrogen as well, so they build up in your body.
So even with a new liver, this guy might still have gynecomastia because of his old liver problems.
Yeah, it's like a reminder that a transplant doesn't magically erase everything. You can still have leftover effects from the original disease, and you got to manage those too.
Earlier, we were talking about the Euclides score and how it helps decide who gets a transplant first. Can you break down what goes into that score?
Sure, the Euclides score looks at a few key things that tell us how well the liver is working. Bilirubin levels, creatinine levels, and INR, which is a measure of blood clotting.
You've mentioned bilirubin a few times. Just a refresher. What is that again, and why is it important?
Oh, right. Bilirubin is this yellowish pigment that's made when red blood cells break down. Normally, your liver takes care of it and gets rid of it in bile, but if your liver's not working right, bilirubin builds up in your blood, and that's what causes jaundice.
Okay, so high bilirubin means your liver might be in trouble.
Yeah.
What about creatinine? What does that tell us?
Creatinine is a waste product that your kidneys filter out of your blood. If your creatinine levels are high, it could mean your kidneys aren't doing their job, and that can be a sign of complications from liver disease.
And lastly, there's INR, the International Normalized Ratio. What's that measuring?
INR tells us how long it takes for your blood to clot. If it's high, it could mean your liver isn't making enough clotting factors, which can be dangerous because you could bleed too much.
So bilirubin, creatinine, INR, these are all pieces of the puzzle.
Yeah.
They help figure out how bad the liver disease is and how urgently someone needs a transplant.
Exactly. And the Euclides score puts all those pieces together into one number.
You said before that it's not always just about who's the sickest. What other things do they consider?
Well, they also look at the patient's overall health and how likely they are to do well after the transplant.
So they're not just focused on the liver, they're looking at the whole person.
Right. It's a complex decision, and they try to be really thorough.
We've talked a lot about the medical side of things, but let's shift gears a bit and talk about the ethics of transplantation. What are some of the ethical dilemmas that come up?
One of the biggest ones is organ availability. There are just not enough organs to go around for everyone who needs them. So doctors have to make really hard choices about who gets a transplant.
That must be incredibly tough for everyone involved.
It is. You're constantly trying to do the best you can for your patients. But there are limits to what's possible when you don't have enough organs.
We talked about living donors earlier. What are some of the ethical issues surrounding that?
Living donation is a whole other can of worms, ethically speaking. It's amazing that someone would be willing to give up part of their liver to save someone else's life. But it's not without risks for the donor.
What kind of risks are we talking about?
Well, it's major surgery, so there's always the risk of complications, bleeding, infection, even death. Those are all possibilities. And even if the surgery goes perfectly, there's the long-term impact on the donor's health to think about.
So it's a big decision, not one to be taken lightly.
Definitely, anyone considering being a living donor needs to be fully aware of what they're getting into. It's a serious commitment, and it could affect their own health down the road.
How do they make sure that potential donors are really making an informed choice?
They go through a ton of screening, both physical and psychological. They do lots of tests, and they have counseling sessions to make sure they understand the risks. And that they're doing it because they want to, not because they feel pressured.
So it's not just about matching organs, it's about protecting the donor, too.
Absolutely. The donor's well-being is just as important as the recipient's.
This whole deep dive has been really eye-opening. It's not just about the surgery, it's about the emotional stuff, the money, the ethics. It's a lot.
It's a whole world, and we've just scratched the surface.
In the last part of our deep dive, we're going to look at what the future holds for liver transplantation. There's some really exciting stuff happening, so stick with us. Welcome back. So we've talked about the challenges, the ethics, all that heavy stuff. Now for the fun part. What's coming next in the world of liver transplants? What's on the horizon that could really shake things up?
Oh, the future of transplantation, that's where it gets exciting. There's so much research going on, pushing the limits of what we can do. One thing that's got huge potential is artificial livers.
Whoa, hold on. Artificial livers. What would that mean for people who are waiting for a transplant?
Well, think of it this way. An artificial liver could be like a bridge. It could keep someone alive while they're waiting for a real liver to become available, or it could give a damaged liver a chance to rest and heal, kind of like a backup system.
So it's like a mechanical liver that takes over for a while.
Yeah, that's the idea. Right now, the artificial livers we have are mostly for short-term use, but researchers are working on making ones that you could implant permanently, like a total replacement for a damaged liver.
That's mind-blowing. What else is in the works?
Gene therapy is another big one. Imagine if we could tweak the recipient's immune system so it doesn't reject the new liver. No more lifelong immunosuppressants, no more worrying about those side effects.
That would be huge. No more rejection, no more side effects. That's a game changer.
Exactly. It could make transplantation so much safer and more effective.
What about 3D printing?
Ah.
I hear they're working on printing actual organs now. Could we be printing livers someday?
Oh, absolutely. 3D printing is getting really good really fast. The ultimate goal is to print a whole working organ using the patient's own cells. No need for donors at all.
Wow, a liver grown from your own cells. That's straight out of sci-fi.
I know, right? But think about it. No waiting lists, no rejection, no immunosuppressants. That would be incredible.
Okay, while we're talking about revolutionizing things, are there any new developments with immunosuppressant drugs themselves?
Oh, yeah. Researchers are always trying to make them better, more effective, fewer side effects. One promising area is personalized immunosuppression.
Personalized immunosuppression, what's that?
Basically, it's about tailoring the drugs to each individual patient. You look at their genes, their immune response, and you figure out exactly what they need.
So it's like custom-made medicine for each person.
That's the idea. It's a big thing in healthcare these days, trying to personalize treatments.
Well, we've covered a lot of ground in this deep dive, from that J-shaped scar to the UCALD score to the future of the field. What's the one thing you hope people take away from all this?
For me, it's the realization that liver transplantation is a truly amazing feat. It's science, it's compassion, it's constantly pushing the boundaries of what's possible.
It's been a fascinating journey for sure. We've talked about the challenges, the successes, the ethics, the future. It's a whole world.
And the best part is, the journey's not over. There's still so much to learn and discover.
Thanks for taking us on this deep dive. Your insights have been incredible.
My pleasure. I'm always happy to talk about this stuff.
And to everyone listening, we hope you've enjoyed this exploration of liver transplantation. It's a complex field, but it's full of hope and innovation, and that's something to be excited about.